Hey everyone, and welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. My guest today is Dr. Sarina Pasricha. She is a gastroenterologist, plant-based, of course, and she's going to share with us some gut health tips for the holiday because tomorrow is a very big day, at least in the United States, of eating and overeating and eating the wrong food, and she's going to help us get through it. Please welcome her to the show. I feel like I know you because I've interviewed you for summits, but you've never been on Chef AJ Live, at least not by yourself.
Yes, this is my first time and I'm very excited. Thanks, Chef AJ, for inviting me. I've obviously been a huge fan of yours for such a long time, and every time we connect, it just fills my heart with happiness. So I'm really honored to be on your show.
Well, I'm so happy to have you on. You came on here. Mm-hmm. I hope you're not.
Sorry, we're cutting each other off.
Yeah.
Can you hear me?
Okay. I can hear you.
Good. Perfect. I was going to say that I'm happy to share a little bit about myself and my journey for your listeners, if you think that's helpful.
I'd love to, because people are always interested in every guest, like when they first adopted a plant-based diet, why, and, like, was this before you went to medical school? We'd love to know your story.
Sure. So I grew up in Delaware. My family is Indian, so I actually grew up eating a fairly healthy diet, very minimally processed food, mostly home cooked food. My mom makes delicious food, but I did not grow up vegan or vegetarian. And then I went to college and I went to medical school. And I will say that that's probably my unhealthiest time period. I ate a lot of unhealthy food, eating in the hospital, eating around the clock, lots of caffeine, Diet Coke, things to kind of keep me awake and energized. And just like overall not healthy. I was studying at that time to be a gastroenterologist. But I didn't really understand that much about nutrition and didn't really understand the importance of what we put in our body and how important that really is, and that food truly is medicine. So then I actually did my college at Harvard UC. I was actually studying a lot of nutrition at that time. And biological anthropology. And from there, I went to Chicago. I went to Northwestern University for medical school. I did a year of research there, actually studying fatty liver disease. I was really interested in this. And for people who don't know, fatty liver disease is one of the most common reasons that people, at least in the United States, have liver abnormalities. And just like we get fat all over our body, we get fat in our liver, and we're seeing a rise in this with the rise in obesity, the rise in diabetes, high cholesterol. It's part of that metabolic syndrome. And many people who get really severe fatty liver disease can develop end-stage liver disease requiring a transplant. So my areas of interest started to get into more about fatty liver disease and really how obesity is impacting our gut health and our GI tract. From there, I went to University of North Carolina, where I did my residency and my GI fellowship. I actually did a lot of research at that time. I thought I was going to go into academics. I do love research. I think it's so important that we are asking the right questions, and then we're getting scientific, research-based evidence to answer those questions. Now, during this time, I also became pregnant, and I had my first daughter during my GI fellowship. And really, up until this point, I did not have much of an interest in nutrition. Really, like I was taking care of my patients clinically, but even though I was in GI fellowship, I was not talking to my patients about diet. I wasn't prioritizing that even in my own life. But once I became pregnant, that was a big shift for me. I really wanted to make sure that I was doing the right things when I was pregnant to try to help my daughter. I really wanted to make sure that when she was born, that I was giving her the right food and right nutrition. You know, as many people might be able to relate as a parent, we might not always put ourselves first, but we always try to put our children first in many ways. And so that was really my shift and my change. And that opened up my eyes to a plant-based diet and a plant-based lifestyle. Because that's when I started to realize that the foods that we eat are so very important. And, you know, for children, when they're born, the first 2 years of life is really critical in terms of gut bacteria and gut microbes. And in order to get the healthiest gut microbes, it requires us to follow a plant-based diet, or a diet high in fruits and vegetables, high in fiber, low in dairy, low in animal products, low in eggs and cheese. And those gut microbes are constantly changing and evolving and are definitely very adaptive to our diet. But those first few years are important. And so that's when I realized that, you know, for my daughter, and to set her up for a healthy foundation, because we know that when we have a healthy gut microbiome, that reduces our chances of developing chronic inflammatory conditions. It reduces our chances of cancer, asthma, arthritis, colitis, so many diseases. And I really feel like, you know, as a parent, as a mom, we want our children to be healthier. So that's when I started to learn about how important it was to breastfeed. That was also really important for me on this plant-based journey, is that realizing that breastfeeding actually impacts the gut microbiome a lot too. So it was important, and I started to focus on breastfeeding. I changed my diet. I changed my diet for my daughter. And as many people who are listening might be able to relate, when one person changes their diet and is on a mission to get healthy, many other people get impacted. So go on this journey by my changing my diet, my philosophy, my belief, you know, that has impacted my children, my parents, my husband, my sister, everybody kind of around us, because the more aware you become, then you change too. And so that was kind of my journey. Really, before that, I feel like I had, like I said, a very overall healthy diet growing up, but with not a lot of processed foods. And then that changed a lot in my 20s. I actually remember going to like get a foundation or makeup one day, and the lady was like, your skin is really bad. I had really bad skin, I was really tired all the time. And I'll say that when I made some of those dietary changes, I could tell the difference in myself. So that was my journey. And I'm a practicing gastroenterologist. I work here in Delaware, and I really like to try to incorporate talking about plant-based diet and talking about diet and lifestyle and stress to my patients, because all of that is so important in talking about GI and talking about gut health. So whatever I can do to kind of share some of that information and some tips, I'm happy to do so.
Do you see patients? Are you still like taking patients if they live in the Delaware area, virtually or in person?
Yeah, we were seeing patients virtually. We really made a switch now to see patients in person. We found that that's helpful to be able to connect, see patients, do exams. So predominantly, I'm seeing patients in person and in Delaware. So if anybody happens to want to come this way, I'm happy to see you guys. But I also try to at least provide education. I don't think, you know, we need to be hoarding medical information. So I do try to share that as much as I can on, you know, my Instagram account. And for anybody who's listening and wants more information, you can go to my website. I'm in the process of coming out with some newsletters, because I think one thing that I always tell my patients, and for people who are listening, is I want you guys to have the knowledge that you need to make an informed decision for yourself. Because as a physician, I can give you information, I can't make changes for you. it's up to you to make any lifestyle changes that you want to make. But if I can at least give you the information, then you can kind of weigh any risks, benefits, and see what you want to do. Because it's ultimately your decision. I'm just here as a physician to try and guide you and help you to be as healthy as you want to be.
So I understand that they don't really teach much nutrition in medical school, but in the field of gastroenterology, you would think that they at least believe that diet has some effect on some of these diseases. They still don't?
I think they do now. I mean, when I was starting my training, we did not really talk much about this. That's also when the gut microbiome was a really new field and we didn't know very much about it. And now we know that, we used to think that, okay, there were gut microbes. We eat food, we take the nutrients, the gut microbes just happen to be there, and we poop out the waste, and that's it. And I think really any of us believe that anymore. We know that our gut microbiome is constantly changing. It is not static. We know the gut microbiome changes based on the foods that we eat. We know that high fiber and fiber rich foods will promote the good, healthy gut microbiome. There are like dozens of articles that every single day that is showing the gut microbiome is being linked to near any and every chronic inflammatory condition that we know of. So I think now we have a much, much better understanding of the importance of diet and the role of diet and nutrition in our GI tract. Now, it's a thing, and so maybe some people are not as aware of it, but if you look at the research, there's definitely a lot of research to support the importance of diet in GI diseases. And just to give you one example, we know, and the World Health Organization has listed like processed red meats, like for example, deli meats, hot dogs, hamburgers, as a carcinogen. So it is cancer causing. And we know that the more red meat that people eat, then they have a higher risk for developing colon cancer. We have seen that link between red meat consumption and risk for colon cancer. So there's now research, and the more the research that comes, we're seeing that link and that connection even stronger.
Wow. That saying, I think it was Hippocrates, all disease begins in the gut. Is that true for even, say, COVID?
Yeah, so that's actually a good thing. I mean, I do believe that all disease begins in the gut. I'm a gastroenterologist. I don't know if it's because I have a bias or not, but of course I do believe that all GI tract, all disease begins in the gut. So with COVID, and there's a lot of research here. There's an article I was just reading. We know that people who followed a plant-based diet actually had less symptoms of COVID compared to people who kind of followed the traditional American diet, which is high in processed food, high in meat and dairy. So we did see that people who followed that plant-based diet had much more mild COVID symptoms if they got COVID. And there's a lot of research. Again, we think it's related to the gut microbiome, but there is at that connection. So, and that actually got a lot of press in not just GI journals, but actually that got a lot of press kind of everywhere. So I hope that it opened up other people's eyes to the fact that if diet is impacting the symptoms of COVID, and we saw that, and we know that plant-based diet lowered those risks, those symptoms of COVID, then it makes sense also that plant-based diet and the foods that we eat have a role in other diseases as well.
That's interesting. Do you mind answering a few questions from some of the viewers? Some people actually sent some in. Okay, thank you. One of them, I'm sure you've heard because it's about what to do when you've been on antibiotics. It's from Jennifer. She says, I just finished a 2-week course of antibiotics for a terrible sinus infection. Is there a way that you can recommend to get the gut microbiome balanced again quickly?
Yeah, so the first thing that I tell my patients, not something that you can really change now, but if you need to be on antibiotics, the best way to recover is actually to have a good foundation to begin with. So usually if you're already following a plant-based diet or following a high fiber diet, then you're setting up your foundation for a faster recovery after any sort of antibiotics or after any sort of insult to your GI tract, for your gut microbiome to normalize and get back on track faster. So if you're already doing that, you've set yourself up for good recovery. If you weren't doing that, then you can start doing that now. Start following a predominantly plant-based diet as much as you can. Get that high fiber diet to tract. You can also do fermented foods like kimchi and sauerkraut. Fermented foods have also been shown to be very helpful for your gut microbiome. I want to say one is, I do get this question a lot about antibiotics, and I do want to say that you should take an antibiotic if you are prescribed and if you need to take one. I do see sometimes patients who are so hesitant to take antibiotics if they need it, but if you need to take it, then please do so. And because if you have an infection, you need to get it cleared out. That's the first thing. Second, try not to overuse antibiotics. Many people want antibiotics, even in the field of GI. They'll come to me and say, I'm having pain. I think I'm having diverticulitis. I'd like an antibiotic. And so I kind of have to go through, okay, well, are you having a fever? Do we have any evidence of diverticulitis? Have we seen any sign of infection in your blood count? I just had a conversation today with this week with one of my patients, because she was saying she was having these flares of diverticulitis and wanted antibiotics. And once I kind of talked her through the disease process, we realized it's not antibiotics. I wasn't going to prescribe unnecessary antibiotics because it does impact your gut microbiome. So that's kind of just like an aside, is make sure you need to take it. And if you do need to take it, do take it. Your gut microbiome after a course of antibiotics will slowly get back toward your baseline. It might not ever go back exactly to your baseline, because once you've had antibiotics, you sometimes do develop antibiotic resistant bacteria, but it hopefully should not cause you any symptoms down the line. The other thing I'll say is that sometimes people ask about taking a probiotic after an antibiotic. And I usually recommend avoiding that unless you absolutely need to. We used to prescribe it quite frequently after antibiotics, and now there's research that actually shows that it might not be helpful, and it might potentially be harmful in certain patients to take routine probiotics after a course of antibiotics. So if you've had an antibiotic, I think the best thing to do to get your gut microbiome back to normal is to eat predominantly plant-based food, low processed foods, low sugars, and also add fermented food to your diet.
Great. Thanks. So any tips for how to brave the holidays without completely disrupting our microbiome?
Yeah, so I love talking to people around the holidays, because first off, this is like such a happy time, right? Like there's so many holidays and festivities, and people are getting together with their families and their children, and we all want to have fun. We want to enjoy, but we don't want to have too much fun and enjoy too much in this time period if it's going to cause us harm down the line, or fullness and drowsiness and sleeping and groggy and fogginess. And, we don't want to feel that way. We want to feel energized. So I have just some suggestions for things that I do to try to stay healthy. Now, I will say that many of my patients, I'll see them before the holidays and I'll see them afterwards. And if they're not careful, it is very easy to gain a lot of weight in this time period, gain 5 to 10 pounds, overindulge. So these are just some tips that I do. I don't think we need to be overly restrictive or strict. I want my patients, I want people to enjoy the holidays, enjoy eating. I do think eating it should be pleasurable. It should give us joy. We just want to overdo things, like all things. So one tip I have is to host.
Oh,
It is, sorry, can you hear me?
yeah, you froze for just a moment.
Oh, okay, sorry. So one of the things that I like to do is to either host or go to potluck dinners. And I think potlucks are a great way, because that way, even if all the other food there might be unhealthy, you know that at least you're bringing one dish that could be a healthy alternative. So like, for example, I like to bring chickpea curry or a cauliflower dish, or maybe grilled veggies. Like, bring one dish that you know is going to be healthy and tasty, and other people will like it.
Oh, you're freezing up. Is she freezing for you guys? Ay, ay, ay.
Here.
Yeah, you're freezing up a little.
Oh no.
You don't know why.
Okay, it says I have good connection. Can you hear me now?
I can hear you now. It was just for a moment. You talked about the potluck. Yeah, they're
Can you
saying.
hear me now?
I can hear you now. They were saying you were freezing for them as well, not just me.
Is it frequent, or was it a
Well, it
one-time thing?
was a little bit bad after that, but it was kind of on and off. Yeah.
Okay, let me see. Otherwise, I might have to switch to a different
Wi-Fi.
computer.
Yeah.
Yeah, I don't know. It says my Wi-Fi connection is good.
It just happens sometimes.
Okay. Hopefully people can hear me now.
Yep.
Because actually, yeah, your connection, I can't hear you as well. Let me see. I think I have good connection. I don't know.
You sound loud and clear now.
Okay, all right. So if I don't, let me know and we'll see. Hopefully it works. So I was saying potluck dinners, that's kind of like my tip number one. My second tip is, if you go to a party and they often have different sizes of plates, you have to get once. I usually recommend starting with a smaller plate and then trying things, and you can always, take seconds and thirds, but start with the smaller plate, then you are less likely to overdo it. Are you able to hear me, Chef AJ?
Yeah, so far so good.
Okay, good.
Thank goodness.
So that's another tip. One of my other tips. Okay, so one of the things that I love are soups and salads. So I like to start off my meals with soup or salad. They're healthy, they're filling, they taste really good. And then you're a little bit more full, and then you can have other foods that you choose too. So if you want to, eat something a little bit more unhealthy, at least you've gotten a lot of nutrition in you to begin with. Let me see, what other tips do I have?
What about all the alcohol, though? That can be a nightmare for some people's guts, can't it?
I have that as a tip too. So, don't overindulge in alcohol. Alcohol is definitely a lot of calories, especially a lot of the sugary drinks. It's a lot of extra sugar, calories. Alcohol definitely can cause bacterial dysbiosis that can change the gut microbiome to be a little bit more unhealthy. So you do want to minimize. Now, I am somebody who I see a lot of patients and people actually predominantly who are not plant-based, most of the people that I see and I treat have and follow a standard American diet. And so when I tell them some of these things, I don't think you need to go from eating all these things, some of these. I actually was talking to a patient of mine just this week, and I was telling her about a plant-based diet and eating the fruits and vegetables and minimizing alcohol. And she was, well, I mean, if you're telling me to cut those things out, I am never going to be able to start over the holidays. Like, I just have to start later. Can you hear me?
Yeah.
You can hear me?
I can. But she doesn't want to start until after the holidays. But there's always a holiday. Every month there's a holiday.
And that's a problem, is that if it becomes too challenging in your mind to make that switch, later will never happen. So I was actually talking to her and I was, it doesn't need to be all or nothing. You can do a slow transition. You can say, you know what, I'm going to start my dinner with fruits and whole grains first. And even that switch will minimize some of the processed foods and meat doing now, which is starting your meals with the unhealthy food. So if you can, even in this holiday season, if you can start your food and your meals with soup or salad or high fiber food and start it with the nutritious food, then you can have the other things that you want, but you're already cutting that down by a lot more than you were before, because later will never happen. So just start to make slow changes now. And these slow changes will help your gut microbiome. And these are good things to do, not just actually around the holidays. These are not just healthy holiday tips. These are just healthy lifelong tips.
Thanks. You know what I was wondering? If the gut microbiome is so important, if people have gastric bypass, aren't they cutting out a lot of their microbiome? Can you hear me?
I'm sorry, I cut out for a second. You're saying if the gut microbiome is so important?
Yeah. What happens when people have gastric bypass? Aren't they cutting out a large portion of their gut microbiome?
You were asking about gastric bypass, you said?
Yeah, I said, doesn't that cut out their gut microbiome?
Okay. So gastric bypass, there's different ways to do gastric surgeries and gastric bypasses. And we are learning a lot about those. They probably do impact the gut microbiome. Most of them and many of them are limited to the stomach and making the stomach smaller. So it doesn't necessarily impact the small intestine and the colon, which is where most of our gut microbiome comes from. So yes, people who have gastric bypass, it likely has an impact on the gut microbiome. I don't know exactly how much. Most of the gut microbiome is from the colon and then in the small intestine as well. So of course, if you've had a gastric bypass surgery or any gastric surgery, then you want to make sure that your meal size is smaller, because the larger your meals, then it can actually cause your stomach to enlarge. Your stomach is a muscle. It can shrink and it can enlarge, and we don't want it to get large. And actually, that's a good thing. Is another tip is that in addition to taking smaller meals, one thing is to slow down. The holidays are a great time to enjoy this time period with your family, your friends, talk to people, relax. Your meals should not feel rushed or hurried. I tell my family and my children this too: the food is not going anywhere. Let's slow down. Let's enjoy each other's company. Let's enjoy the food together. And one of the reasons that's important is it takes about 20 to 30 minutes for the hormones and the signals to go from our stomach to our brain to start sending that signal that we are feeling full. There's hormones, leptin, that are important in this. And so slow down and eat, you'll start to earlier. And if you eat really fast in a lot of very rushed manner, then you might have actually overeaten by the time you get that signal you're feeling full. So slowing down can really impact and prevent excessive overeating. That's kind of, I think, something for everybody. It's also something that's very easy to do. You don't need anything additional. You don't even necessarily need to change your diet for that. It's just almost a mental reminder to slow down, enjoy the time period with your family and friends, and just take a moment to relax.
Thanks. Actually, a lot of people sent in questions. I just was checking the email to see. And the first one is from Elle. And she says, any thoughts on getting specific probiotic and prebiotic foods and drinks?
So don't recommend routinely any supplements for probiotics and prebiotics. I think that the best way to get prebiotics, probiotics is the foods that we eat. So what I tell my patients is the best foods you're going to eat to get those prebiotics and prebiotics are the foods that you're going to eat. Like, I can't give a list and necessarily tell you, because I could tell you, okay, asparagus, broccoli, green peas, avocado. But if you don't like those and are not going to eat it, then it doesn't really make any impact. So really, green leafy vegetables, oatmeal, whole grains, fruits, whatever it is that you're going to get probiotics and prebiotics in the plant-based food. And the other thing that's important is having a variety of fruits and vegetables. We know that variety will feed your bacteria and you'll get more different types of bacteria. When we talk about a healthy gut microbiome, we want lots of good bacteria and we want lots of different good, healthy types of bacteria. And the way to do that is by eating different types of fruits and vegetables. So don't have the same thing every day. Try to switch it up. Try to add a new fruit or vegetable into your diet. One way to do that is to focus on the seasonal fruits and vegetables. Right now, of course, pumpkins are in season, so incorporating pumpkin right now. It's not like one specific magic food that is kind of the secret here, but it's just overall eating a variety of the fruits and vegetables routinely.
Great, thank you. This is a question from Susan, and she says, after being whole food plant-based for the past 8 years, I was so discouraged when my recent colonoscopy report showed that I had 20 small polyps that had to be removed, and I have another scheduled in a year. Is there anything I can do to keep this from happening again?
So first off, I want to say to Susan, congratulations on following whole food plant-based diet. And then secondly, congratulations and kudos to you for doing your colonoscopy. Diet plays a role in colon polyps and colon cancers, but everybody, when they're at the right age, needs to get screened for colon cancer and needs to get their colonoscopy. For the exact reason that you mentioned, even if you follow a whole food plant-based diet, you are at risk for developing and colon cancers. Many people have a genetic risk. Many people, we don't yet know why they're developing colon polyps that can progress into a cancer. But we do know that we have the tools like a colonoscopy to go in and remove anything that is precancerous so that we reduce your chance of developing a cancer. So you're already kind of doing what I would recommend, which is a whole food plant-based diet. And then the other thing is then keep maintaining and getting your colonoscopy, because unfortunately, you know, anybody and everybody can still develop colon polyps with even on the best and healthiest and cleanest diet. It can still happen.
Wow. Doesn't it take a while for them to grow though? So even though she's been whole food plant-based for 8 years, couldn't they started growing before she became whole food plant-based?
They could have started before, we just don't know. But I've also seen patients who have been lifelong plant-based, vegan, whole food plant-based diet, like lifelong. They've never had any meat or dairy. And I've still seen colon polyps that are cancer, you know, causing in patients like that.
Wow. At what age do you recommend screening?
So routine recommendations is 45 years old for the general population. If you have a family history of colon polyps or cancers, then it would be earlier. But the standard age is about 45.
Thanks. This is from Jean. Let's see. People, how safe is the daily use of polyethylene glycol 3350 for adults?
So that is basically the generic version of Miralax, and it's actually safe to use. What it does is it helps people with constipation, and it does so by pulling the water that we drink into our colon so that we're not, see, when people are dehydrated, there's a few steps and few things that we recommend. One is to make sure you're having a high fiber diet. Take a lot of prunes, applesauce, fiber. That's going to help your gut microbiome. It's going to help your colon. It's going to aid in constipation. We also tell people to make sure they're drinking enough water and staying hydrated. If you're not drinking enough water, that can also put you at risk for constipation. So what Miralax does is when you drink the water, it helps to pull the water into your colon to help with constipation. Otherwise, you're just going to pee the water out of you and you're going to urinate it. So the research shows that it is safe to use. It's safe to use regularly. You know, this is a frequent conversation I have with my patients. I always like to try lifestyle and dietary changes first, but many patients do need to be on medications to help their GI tract for whatever disease, illness that they have. It's better to take a supplement or take Miralax or take something to help you have a bowel movement and help with constipation than being constipated. Because when you're constipated and you're not having a regular bowel movement or a daily bowel movement, and that waste product that stays in your colon longer than it should, it ferments. And that also in turn produces unhealthy gut bacteria. It can cause bloating, gas, abdominal discomfort, pain. You're not going to feel good if you're constipated. So the first step is always high fiber diet and water. But if that's not enough, we sometimes do have to use some mild stimulants or laxatives. And Miralax is one of those, and that's really considered to be one of the most mild and safer ones. So that is safe to use. And actually, one other thing I'll say is that, especially since we're talking a little bit about the holidays and Thanksgiving and Christmas and New Year's, many people travel during this time period. And one common complaint or issue that I'll see in my patients is when people travel, their GI tract, their GI tract gets thrown off. They might get diarrhea, but many people get constipated. Sorry. And so, especially if you're traveling around the holidays. Oh, yeah.
It's pink. It was pink.
This is a little bit, yes, it's a little little bit of grapefruit juice and water.
Okay, I thought it was one of those spindthrift. That's what
Sometimes,
I thought it was.
oh no, it's a little bit of grapefruit in there. um, so when you're traveling, pay attention to your GI tract, because a lot of people, like I said, they'll either get diarrhea, but many of them will get constipated when they're traveling. And it's often because when we're traveling, we change our diet. We might not be drinking enough water. On the plane, we get dehydrated. So that's an important point, is to make sure you're not dehydrated when you're traveling this season. I usually carry around a bottle of water with me. Notice that if I don't carry water with me, then I don't drink enough in the day. So that's also a tip, is if you carry around a reusable yeah, it's safe to take. And constipation is a big issue, not just patients traveling, but again, because people are going to be eating different foods than they normally do over the holidays. That can create a lot of changes in your bowel habits, can create a lot of constipation, a lot of bloating, gas, distension. So try to stick to a lot of your normal dietary habits if they're healthy, and don't go too crazy.
Thanks. Here's a question on IBS. How much of a contributor is diet to IBS, and how relevant is a tortuous or elongated colon in contributing to IBS?
So diet plays a huge role in irritable bowel syndrome and IBS. IBS is really a disease process and a syndrome where people can get changes in their bowel habits, bloating, gas, abdominal distension, from a number of reasons: diet, stress, antibiotic use, alcohol, lifestyle. A lot of different factors can impact IBS. I will say that for my patients and people with IBS, the most common phone call that I will get during the holidays is people will have a flare of their IBS. One is because of the dietary changes. Just like many other diseases, irritable bowel syndrome has been linked to the gut microbiome. And so we know that the foods that we eat are going to impact our gut microbiome and going to cause flares of IBS. What can be really stressful for patients is that the foods that cause a flare of IBS is going to be very personalized and very individual. It will vary from patient to patient. So it's not like I can tell you to avoid all these foods and you need to see kind of what foods are going to be triggers for you. That's the first thing. The second thing, especially in the holidays, is stress level. Everybody's stress level is going to increase or change around the holidays. People are getting stressed about getting their holiday shopping, getting their food shopping, seeing their family, planning trips. Everything is coming to the end of the year at work and businesses and kind of finalizing that. So there are a lot of different, things getting thrown at us. And it is important that we all manage that stress. If we do not manage that stress, one of the ways that it will manifest is in our GI tract. That flare of irritable bowel syndrome, it present as worsening reflux, it present as abdominal pain, diarrhea. It can present just in so many different ways. So that's one, I think, key take home is on the holiday period. If you can do things to reduce your stress and self-care, that will be really, really helpful. In my house, I have 3 girls, 9, almost 7, 2. And so my 6-year-old, who's almost 7, just made a family chart for us. she put everybody's name on the list, and she Friday schedule and said, hey buddy, every day we'll do some meditation or yoga, which I thought was great, because that's a great way to reduce the stress for all of us. Research has shown that 20 to 30 minutes, 3 times a week of meditation, yoga, diaphragmatic breathing, where you put your hands on your chest and take deep breaths. These things help calm down the vagus nerve. It helps calm down our GI tract. It lowers the cortisol, the stress level, and impacts not just irritable bowel, but it's going to make all of us feel better. The thing with patients with irritable bowel syndrome is they are more susceptible to feeling that stress. We all have a connection that goes from our GI tract to our brain, that brain-gut connection. So whatever's going on in our brain, that stress and anxiety, it's going to flare our GI tract. And then when that flares, it kind of causes us to feel more stressful. So it's really important, if you're feeling this holiday rush and the frenzy and the craziness, and you're starting to feel like it's impacting yourself and your well-being, this is like my doctor's prescription and recommendation for you is to allow yourself to have that 5 to 10 minutes a day to take a breather, calm your own body down. Because, if we are not giving our own body self-care, if we are not rested, we are not going to be able to care for all of our family members in the best way we need to.
Great, thanks. Can constipation exacerbate nerve pain from spinal compression fractures?
So that's a little bit of a specific and tricky question. We know that when we're constipated, one, it definitely can impact our nerves and our GI tract. It can cause a lot of abdominal pain. We also know, though, that when you're severely constipated, it can cause back pain. So if you have spinal fracture, compression injury, if you have any, and even if you don't actually have any underlying back pain or issue, constipation alone can result in back pain. And many patients actually, that could even be a presenting sign. They might even go to see an orthopedic doctor. Their back is fine, but actually they're so severely constipated, it's putting pressure on their back. So yes, constipation can cause back pain.
Interesting. Thanks. This is from Marie. My sister noticed that ground flax seeds causes reflux. Can you think of why this might be? Chia seeds don't seem to do this.
I don't know of any research to support why that would happen. And I've actually not really heard that in my patients. So that might just be something that maybe she has a sensitivity to, or it just doesn't kind of agree with her, but it really should not increase any reflux.
Okay. Individual variation. This is from.
Yeah. And we do know that, because that is one thing with a lot of GI issues, is that it is very individual, because things that impact reflux and acidity are, one, increased acid, two, stress. You're likely to feel things if your nerves are hypersensitive and are flaring more. Lack of sleep, the timing in which we eat. For example, even, in the holidays and throughout, if you're going to have late dinners and big meals late at night, and then you're going to go to bed shortly after, that is a risk factor for developing and having reflux. You don't want to have a big meal right before you lie down and take a nap or sleep, because then a lot of the food does reflux back and can be irritating. So a lot of these GI illnesses, it's not just usually one thing exactly that is related to the symptoms. It's usually a number of things.
Right. Thanks. This is from Linda. Do you have suggestions to help extreme bowel urgency and inconsistency issues after gallbladder removal on a whole food plant-based diet, but with very little flexibility in my eating schedule? My doctor thinks I might have impacted poop that is causing very loose stools and wants me to take a fiber additive, but I hate it. It messes with me and has all kinds of nasty artificial stuff in it.
All right, so very interesting because diarrhea can be diarrhea and diarrhea can be from constipation. And so, I can't really speak to your specific example, but what I can tell you is that whenever patients come in with diarrhea, it is really important being impacted, having stool in your rectum, not going regularly. All of these things can present as diarrhea. It can be counterintuitive because, yes, sometimes we'll tell patients to increase their fiber, have a high fiber diet, maybe take a fiber supplement. And they're thinking, well, I'm having diarrhea, like, how's this going to help? But really, it could be from constipation. So, if you don't like the supplement that your doctor put you on, the first thing is, have you tried a high fiber diet? Have you really taken a look? Most Americans are fiber deficient. So, and you really can't take too much fiber. The recommendations are, between around 25 grams of fiber, but if you can take 35, 45, 50, more fiber has been shown to be healthy for your gut microbiome. The people in the blue zones who live to be over 100 and healthy have, sometimes 100 grams of fiber. So the more fiber you can have, usually the better. It doesn't cause harm. So try to go up on your fiber in diet if you don't like the supplement. The other thing is many to motility, the speed at which the colon is moving. But the other issue could be due to the pelvic floor muscles not working properly. If the pelvic floor muscles don't work properly, you can have difficulty evacuating. You can have the urge to have a bowel movement. You can get both constipation or incontinence and leakage. So you might at some point also want to talk to your doctor if you're doing things orally and you're still not feeling like you've emptied all the way. There is a study, I do these studies, it's called an anorectal manometry test. And it evaluates your pelvic floor to see if physical therapy would actually be helpful in treating your constipation.
Can any GI doctor do that test, or any doctor do that test?
Unfortunately, no. It's usually a specialized gastroenterology. Like, I specialized in motility disorders. So it's usually somebody specialized in this field.
Wow. If you're already going to a pelvic floor physical therapist, can they do the test?
Rarely they can. They usually, and it also might vary based on where you are. The ones locally where I am, we do the test and then we kind of work together with them so we know where the problem is. Doing the procedure and the test helps for us to know, is it a muscle issue? Is it a sensation issue? Is it a nerve issue? Is it a coordination issue? So doing the test is helpful. Some gastroenterologists focused on motility do it. Some places, some OB-GYNs will do it as well.
That's interesting. You know how they say we're supposed to have 30 distinct, fruits and vegetables every week for the most favorable microbiome? I'm curious how you get that, and what do you eat in a day to get that?
So this is like a fun game that we often play in our house. So if you guys are trying to get to that, magic number of 30 different fruits and vegetables in a day, write it down. My kids love writing it down and seeing like how many different foods they can get in a meal. So we eat a lot of Indian food. And so in Indian food, it's actually fairly easy to get a lot of variety. We can make like a rice pulao dish with quinoa, rice, and we throw in lots of vegetables, peas, carrots, broccoli, cauliflower. So right there, you've got, 6 or 7 different things. I almost always start my meals, my dinners with a soup. I find soups are like the easiest, fastest way. And I just throw whatever I have in my house. So I'll, add some quinoa, rice, mushrooms, corn, tomatoes, whatever I taste good. I feel like you cannot screw up a soup. So that's a great way to get 10 to 15 different types. Add some ginger, turmeric, get your spices in too. We put a lot of turmeric. Turmeric is a great anti-inflammatory. So we add that to a lot of our foods as well. And then ginger and garlic. Ginger really helps with bloating and digestion. You're like having this lentil soup, you can get bloated and uncomfortable, but if you take a little bit of ginger in your food and your fruits and vegetables, then that's a great way to reduce any bloating and gas that you might have. So that it ends up being kind of easy. I have usually oatmeal for breakfast. I add oatmeal, flaxseed, chia seeds. So right there, and then I add some fruit to that. So you get a lot of variety there. And I do change it up a lot. So that helps too. Avocado toast is a favorite. We have a smoothie every day. My kids love to help make it. And that's a great way. You add a ton of frozen fruit. We usually use frozen fruit because it's easier to keep. They don't go bad as quickly. They're cheaper, although still healthy. So add a ton of fruit. And then you can add different flavors to that as well. Acai berry, bilberry.
Oh, where'd you go?
Can you hear me, Chef AJ?
Yeah, now I can.
Can you hear me?
Now I can. Yeah.
Okay.
Bilberry was the last thing I heard.
Okay. Okay. That's pretty much the last thing that I said.
Oh, good. That's perfect then. Here's a question from a live viewer named Chris asking if there's a test. I'm sorry, Chris, I don't know if you're male or female. There's no photo. Should they get for a complete microbiome evaluation to determine if they have leaky gut, candida, parasites, or any gut digestion problems? Are there tests for the microbiome?
Okay. So there is not anything that I recommend. There is no good research at this time to suggest that those tests and studies are helpful necessarily, and nor does it usually change our medical management or our planning. It's not to say that in the future I won't be recommending those things or we won't recommend those, but as of now, the GI, the guidelines that we have, which is what I try to follow, there are no recommendations for doing any test for the gut microbiome. There's really no tests to look at any of those things that are recommended. It's just, there's just not enough research right now to support and to show that it's valid, because I have a lot of patients who will take those and they'll say, okay, it says that I am sensitive to strawberries, but I like strawberries and I don't have a problem with strawberries. And then it puts us in the situation where I don't really know what to tell you, because if you don't have a problem with strawberries, you like strawberries, strawberries are good for you, then I would say eat the strawberries. So I don't think that those tests are worth your money right now, but maybe in the future, as we get more research on those and see if they're helpful.
Right. Here's
the best way to understand and see if your gut microbiome is working is to go based on your symptoms. If you eat well, your energy level is high, you're getting good sleep at night, you're feeling rested, you're pooping regularly, you don't have bloating or pain or discomfort, then you probably have a really good, healthy gut microbiome. And on the other hand, when I see patients who tell me they're extremely fatigued, they're not thinking clearly, they're not able to have a bowel movement for several days, they get a lot of abdominal pain, they are bloated, they're gassy, they're belching, they're burping, then that is giving me the picture that this is not somebody who has an unhealthy gut microbiome. So I think at this time, it's better to kind of go on symptoms and clinical understanding.
Good. Here's an interesting question from a live viewer. If a majorly obese person I love stays at my house for a few months and they eat sad, will I get their yucky microbiome? I think only if they have a fecal transplant, right?
Well, actually, it's very interesting because, there is research to show that the people that we are most closely in contact with, that our gut microbiomes start to evolve and develop together. So, I don't think it's like a disease and it's contagious and you're going to get their gut microbiome, but there is research evidence to show that the family you hang around with, the friends that you hang around with, that those people do eventually evolve and have a similar gut microbiome. In fact, I think there was a research study that not only showed that your gut microbiome will develop with your friends, but on Facebook, even the people who are 1 degree separated, your gut microbiomes tend to be more similar than people that you never interact with. So now who knows if that's because when you stay together, you associate together, you start to eat similarly. Maybe it's because the people you hang around with, you have similar lifestyles and maybe you have similar exercise habits. We don't know, but there is some research to show that the people we hang out with influence our gut microbiome. Now, that being said, I would not worry about having somebody visiting you and staying with you, and that's going to throw your microbiome off. You're fine before, you're going to be fine after. Just keep doing what you're doing and you'll be okay.
Great. Here's a question. Is there any reason why a 1-year-old baby would have acid reflux?
Can you say that one more time?
Why a 1-year-old baby would have acid reflux?
That's really tricky. I saw a patient a few weeks ago and she was telling me that she's had acid reflux from a baby. And so, there is some workup that probably needs to get done just to make sure that there's nothing causing excess acidity and reflux. I think babies seem to be prone to getting acidity and acid reflux, and in a way it makes sense for some babies because many times they're laying down, sleeping, lying flat. They sleep a lot. They often nurse or have milk and then immediately lie down. And their esophagus is smaller. So when we talk about reflux, as an adult, to get reflux, it has to go against gravity and it has to go really high up. But for a baby who has such a small esophagus, they're more prone to acidity. Every baby and child is different. Many people grow out of it, just like many people develop it later. So, I'm not sure exactly why that happens, but it definitely, I'm not a pediatric gastroenterologist, but I would definitely talk to someone if it's a concern.
Thank you. Lydia, who's watching live, says, how can I heal reflux esophagitis? I already eat plant-based, but I don't know what to eat anymore.
So, well, there's a lot of things that can cause acidity and reflux. The first thing is to make sure that you're not taking any what we call NSAIDs, non-steroidal anti-inflammatory meds. And those are things like ibuprofen, Aleve, Advil. Those medicines, although they are over the counter and, in general, very safe, they can cause a lot of acidity, inflammation in the esophagus, and inflammation in the stomach. So try to avoid those type of medications. The second thing is other things in your diet. So you're eating whole food, plant-based, but what about any alcohol or any caffeine? Those things, like people, I have a lot of patients who will drink coffee, and that can cause a lot of acidity and worsen reflux. So that's also something to think about. If you are having a larger meal, you're more likely to have more acid and reflux. So try to have smaller meals, that can help. One of the other things I also talk to my patients about is, I don't know what your BMI is, your body mass index, but those patients who tend to be obese are more likely to have acidity reflux because things are pushing up on their stomach, causing acid. Same thing happens with pregnant women. So those are, and then the other thing is if you've not been checked, make sure you don't have H. pylori, a bacterial infection, as this infection can cause acidity and reflux and esophagitis.
Great, thanks. So Renee says, I have a friend who thinks she needs surgery for diverticulitis. She's now reading Dr. Will B's book. Is it too late for her if she's changing her diet?
Yeah, it's hard to comment on this. So definitely diet plays a role. For most people, there's no emergency to getting surgery for diverticulitis. For most people, you have time. It's really considered an elective surgery. So unless there's something acute going on, you have time before you need to have a surgery. I think it's never too late to make changes. It's never too late to change your lifestyle, never too late to change your diet. So that would be a conversation to have with your doctor about waiting and see how you do. But in general, most patients with diverticulitis do not need emergent surgery.
Right, thank you. What do you recommend for gastroparesis? And maybe you can say what that is. I'm sure not everyone knows.
Sure. So gastroparesis is a motility. So whenever we eat, usually within a few hours, our stomach should start to aid with churning of the food, breaking down the food and the nutrients, and it should start to pass out of our stomach. And patients with gastroparesis have a very delayed emptying. The stomach contents just don't empty at the right rate. So the first thing that I recommend for that is a plant-based diet. And that is because we know that meats take the longest time to digest. So if you already have a slow stomach and it takes long to empty, then when you're eating meats and it takes a longer time to break that down and to churn that food, you're going to have more symptoms that you get with gastroparesis, which is usually nausea, vomiting, abdominal fullness, abdominal distension, bloating, gas, belching. So the first thing is, if you can cut out those meats, high fiber foods, fruits, and vegetables are the fastest to be digested and to leave the stomach. So making that change can help your symptoms a lot. That's kind of like the first thing I would recommend. Gastroparesis can be very challenging. I do also recommend exercise. Anybody who has a motility disorder of their GI tract, if it's in the stomach, it's called gastroparesis. If you have a slow colon called colonic inertia, it'll present as constipation. One thing to remember is that your GI tract is made up of muscles. So one thing that can be helpful is exercise. So that is something I do kind of recommend for everybody, because when we exercise and we get our muscles moving, the GI tract sometimes starts to move as well, and it can help with these symptoms.
Thank you. When you were talking about diverticulitis, Justina asked, what diet or lifestyle changes would you recommend for someone with diverticulitis?
So we are learning so much about diverticulitis. It's very interesting. For decades, we used to tell patients to avoid seeds and nuts because we thought those would get stuck and cause a flare of diverticulitis. We now know that's actually not true. And so, because that was a challenge, and when I saw patients, they would say, well, we like to eat nuts and we want to, continue to eat that. Is that okay? So the research has changed. Now it is safe to eat nuts, seeds, popcorn. And those things are healthy for you. So unless I didn't eat those things, and really, I just recommend a high fiber diet. I think it's really important to make sure you don't get constipated and that your bowel movements are working regularly. And usually fiber is what kind of helps to get your bowel movements regularly active. So usually a high fiber diet is kind of my go-to.
Great, thank you. So any last words of wisdom for braving the holiday tomorrow and keeping our gut happy?
Yeah, so I think I want to wish everybody who's listening and everybody here a happy, healthy holiday season. And I think one of the best ways for all of us to be happy and healthy is to be mindful with the foods that we are eating. And also take the time to reduce any added stress that might be put on in this holiday period. Relax, have fun, laugh, spend time with your family and friends. And I'm not just saying this because those things make us feel good, but those things also have been shown to help our gut microbiome. So I just want, I think that's the goal for all of us, is to be happy and healthy and enjoy this time period. So hopefully some of these tips helped. Don't go to a party hungry. Be careful with what you're eating. I don't think you need to restrict. If you want to, have a chocolate pie, then have the chocolate pie. You don't have to feel guilty with what you're doing and eating. And just try to make it a healthy season for everybody.
Great, thank you. And if somebody wants to follow you on social media, where should I send them?
Yeah, you can follow me. My website is docsarina.com. So, and it's DOCSARINA. And that's also my Facebook and Instagram, Doc Sarina. Come follow me, sign up for a newsletter that will be out soon. I'll hopefully also get out some of these healthy tips on the website, and I can send that to you guys too. I have a few other tips, and so we'll be able to go into more detail there. And thank you so much, Chef AJ, for having me on. It's always a pleasure. And I also want to thank you because, just as a follow-up, Chef AJ and I, we've known each other for a while. I've been on one of your gut health summits, but recently you were so wonderful. You had me on with my daughter, Ariana Karpad, when she was competing in that national kindness competition. And thanks to you, your audience, she won that national kindness competition. She is doing lots of things. We were just actually last night, we were at one of the homeless shelters. We gave a bunch of the kids toys and gifts. And she's gotten books for the children in the area. So we are passing it on. Be kind to yourself, be kind to the people around you. And that is one of the secrets I can pass on.
And be kind to your microbiome tomorrow.
Very yes.
All right.
And maybe that's one other tip, if I can say, is if for whatever reason you're not kind to your microbiome, the microbiome changes rapidly. So again, don't feel guilt or have so many negative feelings on yourself. If something happens, you're not the healthiest, you can change at any time. You can change now, you can change after, you can change in the New Year's. Your gut microbiome will change. It will adapt. Whatever point you get started, your gut microbiome can start to get healthy.
Great. Thanks
It's
so
never
much.
too late.
Thanks, Dr. Pasricha.
Thank you.
And thanks all of you for watching another episode of Chef AJ Live. Please come back at 2 p.m. when we have another show with Coach Sandra Cotto, and we'll be making